Our next guest speaker I'd like to present is Dr. George Forgan-Smith from Era Health in Melbourne. Dr. Forgan-Smith is a general practitioner based in Melbourne. He has a strong interest in male health, mental health and health promotion. 3 times a year he takes part in Camp Quality, a charity for children living with cancer, where he is one of the doctors, companions and medical advisors. He enjoys writing and teaching, and he hopes to inspire men to move towards health in all aspects of their life. Dr. Forgan-Smith will talk to us this morning about why having a GP is vital and the things which men should look out for through the different age groups. Thank you.
Well, look, thanks for having me here. It's not often that I get to do speeches at Bunnings, but so I kind of want guys to hear what I have to say. So kids, if you can hear me, there is face painting. Parents, bring your kids to get their face painted and listen to me yabber on for a little while. So how the hell did I end up being here on stage? When I was trained as a GP in Byron Bay, and I decided I needed to move to a city that was a little bit bigger, a little bit more vibrant. So I thought, well, I'll move to Melbourne. But the problem was that I had no patients. So I thought, well, what the hell am I going to do? So I thought, well, I better make them. So I decided to adopt a group of people, middle-aged fat men, bears. And that's who I cater towards. And the reason for that is because they are one of the highest risk group people for future health problems. And if you get in early, you can make a massive difference to a guy's health. We know that if you have a GP, you are already ahead of the game when it comes to being healthy. If you turn up to see a GP when you're not sick, that's even better. But the average punter, when they come to see me, they're usually falling apart. Byron Bay, I had blokes who would come in and, I ripped my leg open on the barbed wire fence, and you'd see them and they've got this big, massive bleeding gash on their leg that they'd already treated with kerosene for 4 days, and it's like, dude, seriously, come sooner, please. So what I want to talk about today is different age groups and important issues for men in different age groups. The first age group I want to talk about is younger guys, and I'm looking really, really hard, and I'm squinting, and you all look really youthful, but you don't quite meet that demographic. However, you are grandparents or you are parents, so I want you to think about who could this information be useful for. So young guys have particular risks that we need to worry about. The first one is mental health. It's the #1 killer of young men. Absolutely. We lose a lot of young guys to suicide. And it's so important that we are aware of this. The main ones is depression. It's very, very prevalent, but as society gets bigger, we also are seeing a huge surge in anxiety in men as well. Now, I grew up trained in psychiatry. So part of my big thing was, how can we get guys to come and see me before they're brought in by the police or before they're a crying mess sitting in the corner? And I've looked after police officers who've really, really struggled, and some of them have actually gone on to leave the police force, and then I think one of them became a personal trainer. But he was so much happier, so much happier. But the #1 killer for young guys is actually mental health issues. So if you know a young guy who's struggling, if they've suddenly gone quiet, if they're suddenly not enjoying their sport or things like that, it's really, really important. Take the time to sit down with them and say, hey, dude, I'm a bit worried about you. Are you okay? There's no harm in asking somebody if they are struggling. A lot of people worry that if you bring up the suicide question, do you worry that you might harm yourself, that you might cause them to harm themselves? That's actually not true. What we know is that if you ask the question, you can prevent it. If somebody was to say to you, I am a bit worried, then what do? So the #1 thing you can do is get them some help. Get them to their GP, get them to see a psychologist or a psychiatrist or anything like that, that will help make a really, really big difference. And I feel that we've probably got generations of men who've struggled with depression for a long period of time, and you don't need to. There's really good treatments available for that. Other issues for young guys, really young guys, there's a lot of childhood cancers that I've been involved with and that find people at Camp Quality, but also skin cancer is an important one for young guys as well. If you grew up in Australia, there's a very good chance that you've had a blistering sunburn sometime in your life. If you've had that, you are at risk of melanoma, or BCCs or SCCs, other forms of cancer that are very common on the skin. Most people by the age of 60 have usually had something jabbed or cut out by their GP. So it's important. All guys should get a full skin check every year, no matter what their age. You can pick up melanoma early, you can cure it. But late, as we've seen with our footballer mate, late pickup of melanoma is terrible. It's really, really bad. Young blokes are also starting to become sexually active, so sexual health screening is an important thing. Currently in Melbourne, there is a huge amount of chlamydia and gonorrhea going around. There is stacks of it. So it's really, really important. Get a full sexual health screening for young guys. On the topic of sexual health, the penis is a wonderful barometer for heart health as well. The arteries in the penis are around about the same size as the arteries in the heart. So for the guys out there, if you are having difficulties gaining an erection, it's really important. Go and see your doctor because it's a risk factor for a potential heart attack as well. And again, it can be reversed. Young guys are also at risk of testicular cancer as well. The main age group is around about 15 to 25, maybe up to 30. That said, I have diagnosed testicular cancer in blokes up to the age of 47. So it's really important. All guys should get to know their nuts. All right? Once a month in the shower, you can have a slightly extended cleaning session, but the important thing is you need to know, are your testicles smooth? Are they feeling heavy? Are they feeling different to what they would normally feel like? In a previous life, I worked as a singer, and one of my colleagues actually was diagnosed with testicular cancer. He left it very, very late. That said, he was treated. He had the testicle removed. He had chemotherapy. And then, despite everything that doctors say, because we're not that right all the time, despite the fact that we act like it, a lot of the time, he fathered 3 kids, and he was told he would never have kids. So there you go. Just goes to show that the willing will always win. But they're the main areas for young guys. Is mental health. It's really important that we consider the cancers of young people and also early sexual health stuff as well. As a guy gets older, that's the time to start thinking about preventative medicine. So I like to think once a guy hits about 30, it's time to have a look and check for things like a screening test for diabetes. Just a quick check to make sure that liver and kidneys are okay, and we'll do a bit of a blood pressure check as well. It's a good chance to just get into the rhythm, going to see your doctor on an annual basis. As I said, if you're sexually active, you should be seeing your doctor on an annual basis to get a sexual health screening. While you're there, you may as well get your blood pressure checked as well. Now is also a good time to start talking about family. It was mentioned that family is, you can't beat your family, unfortunately. You can pick your friends, but you can't pick your family. So if you come from a family of people that have had prostate cancer, it could mean that you're at a higher risk of developing prostate cancer. That's also if your mother or your aunts or sisters have had breast or ovarian cancer as well. We're not 100% sure why, but there is also an associated risk with prostate cancer and family members who've had breast and ovarian cancer as well. So they're important things to note as well. We did a huge thing in the general public where we were encouraging men to get prostate checks a few years ago. And men got really good at it, coming in to get tested, but now I actually spend a lot of my time encouraging guys, look, if you don't have symptoms of prostate issues, then you don't actually need to be screened just yet. But a lot of guys don't know what the symptoms of prostate issues are, so I'll tell you. So the prostate's a little gland about the size of a walnut that sits just past the bladder, right? And it goes all the way around the tube that drains the bladder. So if it gets bigger, it blocks the drainage of the bladder, and it's a right pain. Guys with bigger prostates have issues like they have to get up at night to pee. We're talking more than 2 or 3 times. Some of my patients get up 8 times a night. You can imagine how bad their sleep is. If you find it hard to start peeing, if you have to stand there and wait 5 minutes before it'll come out, and even then it's like a dribbly tap, then that's a sign that something's not good. If you find that after you've finished going to the bathroom, if you have to go back again because you still kind of got that urge, that's another sign that your prostate is probably worth getting checked out. The other thing is it burning, stinging when you pee, blood coming out when you pee. All of these things are important to go and have a chat with your doctor about. But routine prostate exams, we generally don't do them anymore. There's a blood test. It's an okay test. It's not the best test in the world. But we know that if you get a blood test around about the age of 40, it will give us an idea about what your future risk is of developing prostate cancer. Usually around about the 30s and the 40s, that's when guys also start to gain a little bit of weight. And we talked about how hard it is. It's really difficult for guys to lose weight. And we always say, oh, you should just go to the gym. And actually going to the gym makes people hungrier. They're more likely to eat more. And then they get frustrated because they're like, oh, I can't lose the weight. Certainly anything that will help you to learn the sensations of what a full tummy feels like will help you lose weight. But there's a proportion of people, and these are people who, you know, are really big blokes. The main treatment would be to consider things like lap banding or other surgical interventions, because they can make a massive difference. And as noted, for really big guys, a lap band can actually cure diabetes. You know, they go from needing medication to going off their medications and living a pretty healthy life when they've lost, you know, 30, 40, 50 kilos. It can make a really big difference. Bigger guys are also at risk of a particular disease called sleep apnea. So if your wife has ever elbowed you violently in the middle of the night because you're snoring, that's a particular sign that you may be having difficulty breathing while you're asleep. If your partner tells you that you stop breathing while you're asleep, then that's a really important thing to not miss, because what we know is that people with sleep apnea really do struggle to lose weight as well. So if you find that you are wearing a size 42 neck shirt or bigger, you're at risk of sleep apnea. If you've been known to snore, if you've been known to stop breathing while you're asleep, these are really important things to go and talk to your doctor about. People with sleep apnea are at high risk of falling asleep at the drop of a hat, high risk of car accidents and things like that, because they may fall asleep while they're driving. To get tested for it, it's very simple. You can do a night in hospital where they have a look at how you sleep. They attach you up to some machines. And if they find that you actually struggle to breathe when you're asleep, there's some treatments that are available, including stickers that can go on the nose. They're a bit daggy, but they work. Or a machine that pumps air up into your nose, and that can make a big difference as well. So, as the guys get older, as we slowly creep towards around about the ages of 45 to 50, another thing to be aware of is colon cancer. Colon cancer is very high within our community. We think there may be some dietary components to that, but it's worth considering either a bowel screening, where you have the pleasure of getting to send small samples of your poo and we get to find out whether it contains blood, or to get an actual colonoscopy where you are put into a sleepy situation and they pass a camera into the bum and have a look and see what's going on inside there. If somebody in your family has had bowel cancer, it's really, really important to start getting checked for bowel cancer 10 years before they were initially diagnosed. So if your mum was diagnosed with bowel cancer at the age of 50, 40 is when you should start talking to your doctor about getting checked out for that. Other things that I see guys for in this age group is usually sexual health stuff as well. Guys starting to complain that they're finding it hard to get it up. And this is a great opportunity for me to talk about blood pressure, to talk about heart, cholesterol, and a variety of different things as well. As I said, arteries to the penis, around about the size of the arteries to the heart. So if you go in looking for a script for Viagra, it's a good chance to get a good health screening as well. And sexual health as well. all guys should be getting checked out on a regular basis. What else is there? Gosh. Jeez, I've really yabbered on for a bit, haven't I? Oh, okay. Yes, I've just been immunisations. All guys, please. If you're here in Bunnings, there's a good chance that you're going to hit yourself with something rusty. Make sure that you get a tetanus injection every 10 years up to the age of 50. Older guys, you should be considering getting a pneumovax, and that's to help prevent chest infections. Also an annual flu jab as well. It's absolutely worth getting the flu jab. I get mine every year, and despite I still get a cold every now and then, and we expect that. People will get colds when they get the flu jab, but you won't get the really bad influenzas that are actually killing people, but also that put you out of action for weeks on end. So as a guy gets older, other things that are worth considering is getting your testosterone checked as well. If you're having difficulty with erections, then it could be that testosterone is a little bit low. So testosterone is the main hormone that gives us our sex drive, gives us our hairiness, our beards and stuff like that. We care about it for sex, but I care about it more for bones. Guys, you need testosterone to have really strong bones. So if you're diagnosed with low testosterone when you're young, you can actually prevent getting hip and spine fractures when you're older by replacing the testosterone. So that's easily done with a simple test, which is a blood test, and if it shows up low in one test, we do a second test. If you've got 2 consecutive low testosterones, then we'll actually look at replacing your testosterone. That can be done really easily. You can either have a cream that you apply to your shoulder every day, a patch that you apply to your skin, or you can get an injection every 3 months as well. So there's lots of different ways of getting testosterone back into the body for guys. As we get older, it is important we continue looking after your heart. Not only just the blood vessels to the heart, but also the blood vessels to the brain, to the eyes, to the kidneys as well. That if they get damaged, then there can be problems with strokes, there can be problems with blindness and a variety of different things like that. All of these are totally preventable if you just have a regular doctor. So what I would encourage you guys to do is, 1, have your own GP, somebody that you like, somebody that you feel okay talking with. I go out of my way to try and meet guys where they're at, just have a chat. The fact that I'm here in Bunnings, I think, is fantastic. So if one bloke comes to see their doctor because of a talk in Bunnings, then I'm really, really happy. Then that's great. There's also a sausage sizzle outside. That's always a good excuse to get guys in. And I understand that the beneficiary of the sausage sizzle today is Berry Street, which is to help family violence as well. So again, mental health issues, men, we tend to get angry, we tend to get grumpy when we're depressed. We're not the sort of people that sit in the corner crying. So it's important, if you're feeling this way, look after yourselves and get that sorted out. Older blokes as well, it's very common to feel depressed when you're older as well. It's one of the highest risk groups. You know what, I've talked heaps. I've really yabbered on and I apologise for that. But if there's useful information, I'm really glad for that. But I'm also happy to answer questions as well. I won't be doing examinations here on stage, but that's not bulk billable when it's done in a Bunnings. But I'm always happy to answer questions.
Are you having any questions with Dr. Forgan-Smith?
Yeah, just wait for the mic, because I hope you don't mind I'm recording this, because I hope to share it with other guys. Please.
When you get older, low blood pressure, when you get cold hands and cold feet, how do you improve that?
Well, that's an interesting question, because certainly I feel like I'm in a freezer today. But the thing is that you can, with lower blood pressure, you can get reduced blood flow to the hands and feet, and that's a sign of diabetes. So it's important, 1, get checked for diabetes. The other thing is that if you can keep the core part of your body warm, so wear a jumper, wear a singlet, daggy as they are, I put mine on every day, and it does seem to help keep the blood flowing out to the toes and feet. But if you're noticing that your feet are going numb, or your hands are going really white, or feeling woody, or like you're losing sensation, that's an important reason to go and see a doctor. Go and get it checked out and just make sure that there's nothing else going on. Does that kind of help? Yep, but knock yourself out. There's a an electric jacket that's up for grabs. If you just have to fill out a form over at that table over there, and you can score this super cool electric jacket that'll keep you warm.
Evaluation form.
It's an evaluation form. So after you've said how awesome I am, then you can find out about getting a jacket. Any other questions? I'm happy to answer anything. Yes, ma'am. Oh,
What was the name of that other injection?
which one?
Neuroplaque, the flu.
The what? The flu vax. Oh,
No.
the Pneumovax.
I've never heard of it.
Pneumo, Pneumovax. So it's preventing pneumonia, which is a chest infection. But I'm pretty sure the government pays for that for all people over the age of 65. I think it's 65. Practice nurse in the room. 65. There you go. So yeah, but if you're over 65 or you're diabetic or you've got some other chronic medical illness, you can also get the flu vax for free as well. But for the if you're not eligible for that, it's $20, and most workplaces will give you a flu vax as well. It's worth getting done. It's a little bit late in the flu season now, but certainly worth getting done. Any other questions?
Over here.
Yeah, ma'am.
What's the difference between anxiety and depression?
Okay, so anxiety is a heightened sense of fear, a heightened sense of worry. Right? People who are anxious tend to have high levels of worry and fear, or it might be something simple as, if I go to a theatre and I have a heart attack, what's going to happen? Is an ambulance going to be able to get to me? Whereas depression shows up in different ways. Depression generally shows up as sadness, a feeling of meh. You just don't enjoy what you're doing in life anymore. Your sleep can go off. You lose your interests that you would normally have. The other important thing is that depression shows up differently in men. Men who are depressed are more likely to be angry. They're more likely to be grumpy. They're more likely to be violent. Also, they're more likely to abuse substances. And we're talking about alcohol. Younger guys, it could be methamphetamines, it could be steroids as well. But currently in Melbourne, there is an increase in the amount of use of methamphetamines. And that's an important one as well, because people do all sorts of stupid stuff when they're on meth. But people do equally as stupid stuff when they're drunk as well. So currently we recommend that men don't drink more than 2 standard drinks of alcohol, no more than 4 or 5 nights a week. Have a couple of alcohol-free nights. If you find that you're reaching for alcohol early in the morning to prevent getting the shakes, or if you're feeling that you need alcohol to deal with situations that you would normally be able to deal with, then it's important, have a chat with somebody and be able to get some help, because that's an important issue for a lot of guys as well. Any other questions? No? Doing, going, gone. I'm happy to be harassed later if you didn't want to be on record, so that's fine.
Thank you very much, Dr. George Forgan-Smith. We'd like to give you a little gift as a token of our great appreciation.
Oh, thank you.
And the plants are from Bunnings.